Goodness me, where on earth do we start? Well, let's start with this. How come there have been this series of meetings between trade officials over the past 2 years, 6 years, during which drug pricing patents have been discussed? Are you going to make drugs part of a trade deal with the United States? Is the NHS for sale to the Americans?
No, the NHS isn't for sale, and we're clear about that, and there's a reason for that, and that's because we love the NHS, as do most people in this country, and drug pricing won't be on the table, and we've made that clear in our manifesto. But this is just a great big distraction exercise by Jeremy Corbyn to get away from the tax rises.
And about
no, but it's important.
No, this is important, Matt Hancock. 6 meetings over 2 years. And during those meetings, those officials have not said, we are not discussing drug prices, we are not discussing patents. Because if they had, there would have been one meeting, and that's what they would have said.
No, that is completely untrue. If you look at these documents, this great reveal that the Labour Party said that they had yesterday actually revealed that the NHS is not on the table in the trade talks, which of course is exactly our position. In the 451 pages, there were 4 mentions of the NHS.
Well, even
2
one
of those
mention might be
mentions
dangerous.
were about... I was going through that. 2 mentions were about how, in response to consultations, lots of people had said that they didn't want the NHS to be on the table, and it's not. And the other 2 demonstrate that the NHS will not be on the table. And in fact, in one of the paragraphs, it's explicit that it says we are not expecting this to be a major offensive ask. This whole thing is a distraction exercise by Jeremy Corbyn.
President Trump
from the fact he wants to put up your taxes and his total
I know you want to
confusion on
distract
Brexit.
us by talking about Jeremy Corbyn, but let me talk about President Trump, who says that he has instructed US trade reps to make fixing the injustice, which is what he calls us paying less for American drugs, fixing this injustice is a top priority. A top priority, the top priority possibly, in trade talks. Now, you might say drug prices are not on the table, but if after Brexit we want a free trade deal with the States and the States says, well, we want better access to your drugs, or to your drugs market, selling our drugs into you at higher prices, is that a deal breaker? Do we say we're not going to do the deal?
That's a deal breaker, yes, because we've said that it's not on the table. And why would we? You know, I fought, for instance, incredibly hard over the last few months to get Orkambi, a life-saving drug for cystic fibrosis, to get that available on the NHS. It's an American drug made by an American company, and we fought for months to get that at a price the NHS could afford. In fact, we were criticised. Scotland paid a higher price and went earlier, and we held out. We got it for a really good price. And I've had people come up to me and say, you have saved my life because of what we did on Orkambi.
We don't
That's the
want
approach
to
that we take to
compromise,
getting
do we?
drugs
You're
at
saying,
good
why
prices.
would we compromise on drug prices? But how come then it has been discussed? Patents and prices have been discussed in these 6 meetings between UK and US trade officials.
No, what the documents show is that the NHS is not on the table. And it says that that isn't something that the US is pushing for. And as I say, it is important at this point about this, where the Labour Party behaved, because this isn't on the table. The documents actually, when you read them, and it's worth reading in full, they demonstrate our argument is correct.
It
that
certainly
the NHS
seems, though,
is not
Matt,
on
it certainly
the table.
seems like it
But
has
more
been discussed
importantly,
and
the
talked
reason,
about.
But no, it's not on the table. And the reason that Jeremy Corbyn has put tried to turn this into a story in this election is because his position on Brexit is so confused.
No, the reason
and
that
because
he wants
was
to
getting
talk about
found
it
out
is
for wanting
because
to put tax rises up.
people do not want the NHS to have to pay billions more for drugs. I mean, that's the simple reason that the Labour Party
nor do
are
I,
talking
and nor
about
will it. So, no, you see, the thing is that that isn't going to happen. We're committed to it. To the NHS not being on the table. I mean, I don't know how many times I've said it.
So can you state your
Matt,
will you state your reputation on that to us now? Will you state your reputation on the fact that when it comes to this, that you will stand by this, and if that ever were to happen, you'd stand down, you'd walk away, because actually you've said this over and over again, it's not on the table, the NHS is not for sale, so you would walk away. If suddenly there came a time when we were suddenly seeing the government negotiating with the Americans,
over
say,
drug
right, that's
prices.
it, I'm going to have to leave now because I swore to the British public that this wouldn't happen.
Yes, we'd walk away, absolutely. And we're totally clear about that. And that's why, and everybody knows that, and Jeremy Corbyn knows that, and anybody who knows has read the documents knows that they show that it's not on the table. And that's why, it's been, Jeremy Corbyn is trying to distract from the fact he hasn't got a position on Brexit.
But what
and he was in terrible trouble in this campaign.
I know you keep on going, and of course you want to keep knocking the Labour Party. But we have been told that after Brexit, when we're out, we're going to get these amazing trade deals around the world. Well, if the first stumbling block is that the Americans say, well, we want access, we want to sell in our drugs at higher prices to your NHS. President Trump says that's the top priority. US wants total market access. And that's the first thing. We've already discussed it in these meetings. And we say, that's not on the table, then that's it. That's our trade deal. You've already admitted that's our trade deal with America gone.
No, it's not, because this is, as I said, in the 451 pages, this is mentioned 4 times, so it's a tiny point. And
well, it's a massive point if it comes up in the negotiations.
The reason that but the reason that it wasn't discussed and the reason that the documents show that it's not on the table is because we're absolutely crystal clear about it, and the Americans know that, and Donald Trump himself has said that the NHS isn't on the table, and what matters is making sure that in this election we have a proper discussion on the proper facts, and that's why this subject has been put on the table by the Labour Party, because they want to get away from the fact they've got nothing to say on Brexit.
Let's talk about something else that needs some clarity as well, because there's been some confusion about the promise for 50,000 new nurses.
More
extra nurses. More nurses across. Absolutely, across this government. You're saying the NHS from 280,000 will go up to £330,000. Those 50,000 nurses. Those 50,000 nurses.
Nurses.
I'll get there in the end. Those 50,000 more nurses, Matt.
You have to forgive us for being slightly confused, Matt, because we spoke to Nicky Morgan this week on the programme, who admitted that 50,000 more nurses would include 19,000 who already exist in the NHS, which by anyone's calculation means there are only going to be 31,000 more nurses.
No, 31,000 new nurses, 50,000 more nurses in total, because some nurses do leave the NHS, and I want to reduce the amount of nurses who leave the NHS and go and work elsewhere. I want the NHS to be an even better place to work, and by reducing the number who leave, you increase the number who are there. By definition. So 50,000 more nurses. I understand that Piers got a bit muddled, and it's a shame that he's
not just Piers. That's not fair. It's not just Piers. It's not just Piers. But Matt, if those nurses are already working in the NHS, they're already there, and you're just choosing to make sure that they stay there, how can you describe them as more nurses? They're already there.
You're double counting them.
Yeah, because the commitment is to increase the total number of nurses who are currently working in the NHS from 280,000 to 330,000. That's a 50,000 increase. And of course, if you run any organisation, to increase the number of people you've got, you want to hold on to more of those you've got already, and you want to get new. And that's
Matt
what we're
Hancock,
going to do.
Why don't you just go the whole hog and say we currently have 280,000 nurses, we're going to have 280,000 more, because we're going to persuade every single one of them to stay.
Well, at the moment, about 27,000 leave each year, and we want to reduce that figure. Because working in the NHS is an amazing thing to do, but I want to make sure that it's even better working in the NHS.
With all due respect to you in your position, can you not see how the numbers don't make sense to people? If you are hanging on to a member of staff, that person is already counted in the figures. You don't add that person to the figures because you persuade them not to stay. I mean, not to leave.
But if they were to... No, but if they were to leave and then you improve the working conditions so they don't, then you end up with more people at the end.
But
the point is this:
you keep them, you don't gain them. You keep them.
Let me come back to the. Let me come back to the central point, okay? Which is about what is our commitment to the NHS? What is our commitment to making sure that the NHS is always there and stronger by the end of the next Parliament? The commitment is that by the end of the Parliament, there will be 50,000 more nurses in the NHS than there are today. I know, and so that's the commitment to hold us to. We then set out the plans for how we plan to get there. But the key is on this. I'm really straightforward about what we're promising. We are committing to, we have the funding for, we have the long-term plan to deliver more nurses in the NHS, 50,000 of them, in the totality of how many nurses there are. And that's the clarity that I think people are looking for.
The problem is people are watching and they're going to consider what you're saying. We're just trying to hold you to account to what you are saying. You're massaging the figures so it sounds exciting. Massaging the figures. Everyone's going to be sitting at home saying, how can you retain a nurse and then count her or him as another nurse? You just can't do it. That just is not how it works.
So the reason... I understand that. And the reason I'm so emphatic about this is that it really matters to me that, and the words we've used are very, very clearly chosen. We have not said 50,000 new nurses coming in from outside. We've said there will be 50,000 more nurses than there are today. And if you're in a bed on a hospital ward, and what you want to know is there are enough nurses and there are more nurses on the ward. It matters less to you whether somebody's a new recruit over the next 5 years or somebody who previously, without any changes of policy, might have retired early or left and gone and done something else. And instead, because of the effort that we're going to go to, because of all the work that we're going to put in, and because of the policies that we've got, for instance, on better childcare, that person has decided to stay. In fact, one of the best ways to increase the number of nurses in the NHS is to ensure that the nurses who are currently there don't leave, and because then you do end up with more nurses. So I'm really clear that it's more nurses, not new nurses. They are already counted in the numbers. And what people don't understand is, why didn't you just say we're going to recruit 30,000 new nurses? Why did you have to get yourself in this muddle by double counting nurses who you're just going to persuade to stay? Because it is absolutely... We've been really straightforward about it. The way that we have made this commitment is on the basis that there are currently 280,000 nurses and there are going to be 330,000. And what matters when you're running a large organisation is how many people do you have to do the job. And that is the way that we've framed the commitment. Because, that's what matters by the side of the bed. Yesterday I was in a hospital in Cornwall. What matters in that hospital is that they have more nurses. Yes, and that's what they're going to get.
I know, and we heard some of those nurses challenge Boris Johnson, asking, where are you going to go get those more nurses from the magic nurse tree?
Absolutely. And we've got a plan for that. But we've got a plan. We're going to have more apprenticeships, for instance. We've got more apprenticeships in nursing. I think that apprenticeships are brilliant. We're going to hire more nurses from overseas. I don't know if you saw overnight, there's figures showing that we've got an increase in numbers of nurses coming from overseas. That's a good thing. Yeah. We're also going to have more university training for nurses. So absolutely. And we're going to do more so that nurses who have already got a qualification and then taken time out maybe to raise a family will come back to the NHS. We've got a plan to deliver and a commitment commitment of what we're going to deliver, because we love the NHS.
We do.
We all
do.
love the NHS.
We're going to have to leave it there. Unfortunately, Matt, we have doubled our time with you. The Health Secretary, we're going to have to leave you there, Matt Hancock. Thank you for joining us this morning and coming on finally, though. It's good to speak to you.